Welcome to our final program of the She Opened the Door Ask the Expert Series, Season 2. I'm Kate Pope, a 2013 graduate of SPS and co-chair of the She Opened the Door Committee. The She Opened the Door Ask the Expert series features Columbia alumnae speaking about their experiences, challenges, and achievements in an interactive setting with audiences from across the globe. I am now pleased to introduce our speaker, Dr. Ashley Lerman. Ashley is a Columbia University alum, 2018 and 2020 of dental medicine, and current founder of Firstgrin. Near the end of today's program, we'll have an audience Q&A. You can use the Q&A feature at the bottom of your screen to submit a question, and we will try to get to as many of these as we can. Welcome, Ashley. It is such a pleasure to have you here with the She Opened the Door community. It's so exciting to chat today and delve into your journey of pediatric dentistry, health tech, and creating a company for families.
Thank you so much for having me. So excited, love the whole initiative, and excited for our conversation.
Great. Well, we're going to start a little bit back in your early experience with your undergraduate years at NYU. Did you know early on that you wanted to be in the dental medicine space? And also, how was it having two parents that are already dentists?
So they were obviously a huge influence on me. They still work in a two-chair mom and pop office. So I would go with my brother growing up while they were working, and we didn't necessarily have childcare. I know we'd blow up the gloves as balloons and just kind of play there, but we'd also help out answering phones and that. So that definitely played a huge part in my interest. I always knew I wanted to do some type of medicine. So the pre-dental and pre-medical track where I went to school were the same. So I went through that and I really tried out a bunch of different fields, and dentistry stuck with me. So I was really excited and fortunate to have that early exposure through my family too.
Now, you have a 2018 and 2020 degree from pediatrics from Columbia. Why did you choose kind of to center your training on dentistry?
I love the hands-on aspect of dentistry. I like that you get to build a long-term relationship with the patient as well. You really get to know families. You see them 1 to 2 times a year, and building on that. So I eventually chose pediatric dentistry because it really revolves around the behavior, the psychology, working with the family unit, so the parents, the caregivers on the diet, the nutrition, not just necessarily fixing and doing things with my hand, which I also liked, but I like that full body full person perspective that pediatric dentistry brought to the table.
And is there anything different you would have studied now that you're practicing in the field of dentistry and oral health, or other courses maybe you think back and go, oh, I wish I would have taken one of those?
So with pediatric dentistry, there's such a strong public health foundation. I don't think a lot of people know that. When you think pediatrics, you're obviously thinking just kids, but what we were taught was the foundation of disease, how to prevent it before it starts. So I look back and I wonder if I should have done like an MPH, and I know Columbia has an amazing MPH program. We worked very closely with them, and I was very fortunate to meet with a lot of students in the MPH program to have helped the Firstgrin journey. So I think maybe taking more formal applications of the MPH classes would have helped.
And is that for those that are in the audience considering a similar career path? You've mentioned MPH. Are there other skill sets or qualities that you think would have a meaningful impact in the field? And they could be undergraduate courses, graduate courses, courses later on.
Yeah, so I have zero business background having started this health tech startup. So I really recommend and could suggest any, baseline business classes. I think that would have been really helpful as well. But then just classes that you're interested in, like a photography class, I don't know, a sculpture class, things that you don't necessarily get to explore in the real world after school, things like that, because you aren't devoting a certain chunk of time to it. So I think being able to explore your ideas, your passions, and just things that could make you a more well-rounded person.
It's great advice. So before we dive into creation of Firstgrin, we wanted to go back and think about what drew you specifically to pediatric dentistry and how that differs from other forms and your approach to oral care.
So I mentioned a little bit before, but with pediatric dentistry, I love the behavior and prevention aspect. I love nutrition, diet, how we can prevent disease before it's established. I'm really interested in being proactive with healthcare rather than reactive, and Dentistry is very reactive. Like you see a problem, you fix the problem, you build a problem. We see that in other types of medicine as well. But for me, with pediatric dentistry, when you start with a clean slate for a child, you have the ultimate chance to prevent disease. And I love working with moms, with dads, with caregivers to be able to prevent it because cavities are kids' number one chronic disease and often very preventable. And I know you and I were discussing quickly as moms, no one really tells you what to do with oral health and many other things in parenting, but just seemed like a great opportunity to try to make a better solution for families out there.
I think that's great advice, and I know we both have little ones, and I shared that sometimes you don't think about the dentist until maybe it's a little too late as your kids get older. So, as a mom and dentist, what advice do you have for families now on how to handle that early childhood dental care?
So we recommend starting early. Before there are any teeth, just start wiping the gums. As soon as there's a first tooth in the mouth, introduce a soft bristle toothbrush, a rice size amount of toothpaste, and then ideally you want to go to the dentist by age 1 or 6 months within that first tooth coming in. That's all guidelines, and we know that reality and ideal don't often add up, especially when you're a busy parent, but they're just good things to keep in mind because again, often no one's really telling you this until let's say you have a 5-year-old and your habits, behavior, diet is all established, it's harder to undo that rather than starting off on like quote unquote the right foot.
Any early advice is wonderful. And how do you see improving access for pediatric dental care and supporting better oral health outcomes for children in the future years?
So there are a lot of changes in our public health system right now that we know. Um, with the Medicaid population or a lot of the people in our country, there just isn't access to seeing a dentist, let alone a pediatric dentist. So with Firstgrin, our goal is to send information and material and oral care kits to people through the door. So A, they don't have to go to the store and make that decision because they're not thinking about it. Um, or B, they may not, know. So I'm just excited about the opportunity to change the conversation around access to care as we're in this constant changing landscape of healthcare and hopefully preventing disease before it's established.
Now we get to dive into Firstgrin, which we're really excited to hear more about today. So, we're going to start with just what inspired you and led you to create a healthcare company for children's oral health.
So my first job out of residency, I was seeing between 60 and 80 patients a day, 10-hour days. I would come home and just be horizontal on my couch. And I told my husband at the time I didn't have kids that there has to be a better way to do this. So I know we quickly talked about this too, but I decided to create an oral care kit to make something really cute, almost like a baby registry present, commoditizing information, education, prevention to get this through people's doors before they're getting to the dentist. So my first customer was a grandmother on Reddit in California who I found and sent this out to, followed up with her, had a couple of the other customers after that, and did a ton of focus groups around that. And I was like, there's clearly something here in a very, very white spot where people aren't taking the time to educate and prevent, and it has huge, huge implications for preventing disease.
And what are some of the early challenges that you faced when creating this business?
So I have no business background. So really, I think challenges was just how slow moving everything was, like from figuring out how to file an LLC, finding the right lawyer, doing all of this paperwork that I had no formal education in. I have bootstrapped this from when I started. I decided not to raise money, though I've had investors come to me, which I'm very, very grateful and lucky to do. And it's just a very different path. Like I've had to do this tooth and nail from the beginning by choice, and it's been really, really fulfilling in that way.
So, on the reverse side, have you had any quick out of the box successes with this?
Definitely. So the social media growth has been huge. I never intended to be an influencer. My goal isn't to be pediatric dentist mom, get brand deals. I lean into this because I think people turn to social media to learn and educate. And when you're nursing, you're feeding your baby at 2 in the morning, you may take out your phone and just scroll. So I was like, let's use some evidence-based information in a format that people like to understand. And that in itself has been the marketing for Firstgrin, and it's really just blown up on that end, and I'm super proud of it. I take it very, very seriously. The trust that people put into the company and myself as a pediatric dentist and mom means everything, and it's really why I started the company.
I think you're right. As a mom, you didn't think that maybe you would get as much information from the internet as you do. And I am guilty of that 2 a.m. Googling something or looking on
Totally.
Instagram really quickly. So, can you go into more detail of how you've used technology and social media to really start Firstgrin, but then also to continue developing it as a company?
Yeah, so when I started Firstgrin, I did not want to be the face of the company. I was like, I'll work with other influencers. I want to be behind the scenes. It was just like a self-conscious thing that I had. And then influencers were trying to charge me like $10,000 to $15,000. Didn't have that money in the company at all. It was just seemed so overwhelming at the time. So I was like, I'm gonna start posting myself, lean into it, build into this. And the virality of it has been huge on Facebook, Instagram, a little bit of TikTok. But again, my goal isn't, having a big following on social media. It's really just the trustworthiness for what we're teaching parents and getting into that early window to actually make a difference. So social media technology has been huge for Firstgrin, building out the oral care companion app, because I don't believe a toothbrush alone cures disease. We need the education prevention that we made, in your pocket as your oral care companion. That's a trustworthy resource for parents to have.
It's great to know that there's something out there on social media that is factual and
Yeah.
helpful and backed by science and all of your work. Through creating Firstgrin and kind of the building of it and then actually launching it, did you have any mentors that really played a pivotal role in this process for you?
So many. I mean, obviously my parents and my family, they're my like executive board, sounding board. If I have an idea, if I need, a different perspective, I'll always call them. But then when I first started this, I was cold calling people from insurance companies, payer companies, medical groups, being like, how would this fit into the system? Because I know dentistry is so siloed, much like other parts of the medical system. But my goal is to connect the two. So that's how we go through the maternal oral health lens by sending new and expecting parents this kit like a baby registry present. So we're really highlighting this important moment of a family's life and also educating and setting the stage for oral health down the line, which I find extremely valuable.
It takes a village.
Yes, yes, understatement of the century, it truly does.
So one of the unique aspects that you've created with Firstgrin is that it's online support, it's guidance, it's tools, it's the oral health box you've mentioned for families. Can you describe how this model makes oral health more accessible by hitting all of these targets?
Yeah, so I mentioned before, but access to care is a huge, huge problem we're dealing with in this country. We don't have enough providers, et cetera. The list goes on. So what we do is we're getting specific claims data from partners that we're working with. We're piloting. So as soon as a person's pregnant, we get that information. We send out a kit proactively before they're even thinking about going to the dentist. And I really think a lot of medicine, healthcare should work in that system, in that proactive phase rather than reactive. Once you see a problem, then you go fix it. My vision with this company is to prevent the disease before it starts, and there's huge, huge value in that, and making it cute and fun and not forcing more work on families. So we send you a little present for your baby, and it's just worked really well. Like I love the psychology around it, and we've had so much support from families, and I love having that community around it too.
Now, as well as being a founder and creator of Firstgrin, you're still a practicing clinician. So we thought we would kind of delve into how you balance the two and how maybe you've looked at that being an entrepreneur and also still practicing in pediatric dentistry.
So I think being a clinician has been so fundamentally important for this company because I understand the pain point like the back of my hand. When I was first starting Firstgrin, I was talking to all my patients about, hey, how would this work? Do you like this? What do you like? What don't you like? And it's been my own R&D to create what I know is, approaching a big, big problem. So having that clinical perspective, understanding where insurances play, where clinicians play, where me as a mom plays, as a parent, bringing my child into the doctor and the healthcare system aspect, it's just been really well rounded. And again, I feel grateful to have this perspective, and it feels important for me to try to make this change for families too. So I love the balance.
And how long, from when you kind of thought about Firstgrin to actually getting up and running? I know we have a lot of people who are thinking about being an entrepreneur. What was the reality from the idea you had and then the actual rolling that out to one of your very first boxes and having your online community?
So I would say from having the idea to filing my LLC for the company at the end of 2021 was 6 months. When I filed the LLC, I didn't know what I was gonna do, but I knew I was gonna do it. I wanted, again, really brand forward, so I just like Google cold called designers to come up with something that was really catchy for the baby space. And I mean, my advice for entrepreneurs who want to start something is just start small. If you look at the big picture, you're going to get overwhelmed, and even forward more momentum is better than nothing. So I've made a million mistakes and will continue to make a million mistakes, but you can always pivot. You have to be so resilient. And what Firstgrin is today is very different than what it started out as. And I think you have to be open to the flexibility and adaptation as well.
And are you still confident that not going with outside investors was, if you had to do it all again, would you still choose to bootstrap it, or would you go back and say, I don't know, maybe I should have done some investors?
Bootstrap 100%. Like, it has been so hard, especially in the beginning. It was so, so hard. No one took me seriously. They were like, is this just like a hobby that a mom has and like not doing anything? But reaching out, cold calls on LinkedIn, I will never underestimate that because there are people who actually want to make differences and gave me the time of day, became mentors, helped connect me to people, and have been absolutely incredible to getting us to where we are today. So I think the value in bootstrapping for me really, really worked out. And that's not everyone's journey, but I'm happy with it.
I think that'll be great advice because I know everyone worries that they have to have all of the funding in the bank, multiple investors, everything planned out. So I think it's really interesting to hear your organic process of creating First Grin. Now, technology and social media, I feel like changes every single day. So, how do you see healthcare apps and technology transforming pediatric dental care in the upcoming years?
So I think we could talk about this as a whole for healthcare, medical care. Everyone's talking about AI. Obviously, it's so buzzwordy, and in the dental sphere specifically, a lot of AI is geared to detecting disease. So there's a lot of room for that. For example, on X-rays, whatever that may be. Um, for me, in the beginning, when people like I had an integrated AI in a way, weren't taking me seriously. And then once they realized that I understood this pain point and was able to get people into dentists and educate and prevent, they're like, oh, okay, that makes sense. So there will always be room for technology education. If you have ideas that don't necessarily lean into that, I wouldn't get discouraged. There will always be that buzzwordy trend. I know it was NFTs at one point, whatever it may be. It's huge. We're at such like a turning point in the world with technology, especially AI. So I'm excited about it. And it does play into a little bit of what Firstgrin does, but I wouldn't want anyone to get discouraged if, their solution doesn't necessarily lean into what the buzzword is of the month, the year, whatever it may be.
And are you currently trying new technologies for First Grin?
Yeah, so many. We are integrating AI into our app just for cavity risk assessment, things like this, so we can personalize, help enhance behavior in a gentle way that is individualized, which I think is really important in healthcare overall, like not a one size fits all, and to personalize messaging with tips and information for how you can improve your family's oral health and things like that. So that's the thing that I'm most excited about in terms of technology for us.
It's great to hear some positive AI usage
Yeah,
when you
thanks.
hear so much about it nowadays. So First Grin has been around, and where do you kind of see your next 3 to 5 years with the company?
So next 3 to 5 years are so exciting. Even this year alone, the partnerships that we have on the schedule, um, it's gonna blow up in scale in a way that I'm really nervous about, really excited about. But it seems to go hand in hand with a lot of payers leaning into value-based care, a lot of product companies seeing the opportunity to get in touch with families and educate and prevent because the consumers nowadays don't just want a product being sold to you shoved in your face. They want the community around it. They want to see the humanity behind it. They want to see a tired mom being like, I don't know how to brush my kid's teeth. Like I myself have a toddler who hates brushing his teeth, and people from Firstgrin love seeing that because it's relatable. There are kids who like it, but my kid's not one. And that's a blessing because I get to deal with a pain point and get to reframe it and think of creative ways to teach around that.
I think at the She Open the Door community, we talk a lot about the human connection. And I think that folds right into that, that you can have the most amazing product, but if there's not a human connection, a community behind it, it's really hard to promote that and get people interested in that. Well, of the many things that you have done, in the clinic and creating your first company, we also know that you've been involved in philanthropy and leadership over the years, specifically with Harmony Health. So, could you kind of share your involvement with them and how that's come about?
Yes, so Harmony Health is a nonprofit that we work closely with, and we go to different states or other initiatives reach out to us because if they have financial reasons to only work with nonprofits, they'll work with Harmony Health. One of their main mission goals is equity to care. So we'll work with in-home visits postpartum where our kids are delivered to new and expecting families, setting the stage again on how to take care of oral health from the start, as well as maternity and labor wards through hospitals. So again, one of the biggest missions for me, my company is a mission focused company, but to work alongside nonprofit to make sure these kits and this information is getting across the country to the people who need it across the board, because access to care is for everyone, like the baby registry space, as well as the low socioeconomic space, wherever that may be, everyone can benefit from this. So I'm super, super proud to work with Harmony Health and all that they do.
That sounds great. And lastly, before we get to our audience Q&A section, what is a personal passion that keeps you balanced outside of all of the dentistry and entrepreneur work that you're doing?
Just my family. I mean, I just feel so lucky to have my family that's healthy and safe, knock on wood, and to have them go through this journey with me. I was pregnant with both of my kids as I was building this, and I would come on to calls and people would be like, "Who's your co-founder?" And I would like rub my belly for good luck. And inside entrepreneurship, outside of entrepreneurship, they've been with me, and to be able to take a step back and know that I'm building something for kids all around and get to take a break from that and spend time with my family disconnected is just the most meaningful thing to me. So I feel again like super grateful and lucky to be able to do what I'm loving and have a loving, healthy, supportive family too.
It's great that Firstgrin is shared so much in your personal and professional life. Like everything is really combined. Um, and like we said, it does take a village for all the moms out there and families out
Yeah.
there. So we have our first question. You mentioned registries throughout our conversation today. Do you
Yeah.
have any partnerships with registries or other companies that you work with currently?
So we work with baby lists. So you could put our kids on baby list. That's a really popular way that people find out. A lot of people register with baby list, and then we've had a lot of grandparents in the community, parents, or just people going to baby showers go on our website and order them either directly to the baby shower or to the person who's having the baby's house, or they order it to themselves and bring it.
Okay. And then we have another one that says, do you combine nutritional advice for healthy gums and teeth along with proper hygiene practices?
Yes, so it's very well rounded. We talk about snacking frequency, acidity of foods, the sugar aspect of foods. A lot of people think with teeth it's just candy and soda bad, everything else okay. We talk about the nuances like drinking milk throughout the day and how that can increase your cavity risk. So, yes, definitely it's a well-rounded nutrition both for teeth and gums, gum health more evolving around the flossing and why that's important. So, a lot of conversation to be had, and the app covers all of that.
And are there any tips and tricks for parents out there of, best nighttime practices or daytime practices that they should be kind of on the lookout for and then have more information in the app?
Definitely. So we make sample routines, how to break it down. And the biggest thing is I don't want to shame parents or make them feel overburdened by more information. My goal isn't to make you feel terrible as a parent because there's so much information online that you just can't do everything. But my whole philosophy with this is progress over perfection. So if you can't floss every single day, just aim to do it when you can, those kinds of things. But we do break down those sample routines and what you should aim to be doing on the app as well.
And for those inspired by your journey and eager to explore more into creating their own business, are there people or organizations or associations that you have followed or are currently following that you think would be great advice for others that are looking to maybe create a company?
Yeah, so one of the companies that I love to highlight is called Luminary in New York City. The founder is Kate Luzio. She's incredibly supportive, incredibly smart, just really helpful. Highly, highly encourage people to check out. There's an actual space in the city and there's a virtual community as well. And then reaching out to people on LinkedIn. There are tons of opportunity, even the cold DM on Instagram. And if anyone wants to reach out to me on LinkedIn, Instagram, I'm very responsive. As long as it doesn't get buried in like at the million folders on Instagram, which I haven't fully figured out, but LinkedIn is a sure bet.
And have any of the people that have bought your products become a client?
Yes. So as Firstgrin has grown, I've slowly been taking less time with clinical in person just because the goal is to amplify prevention as much as possible. But we've actually had a ton of conversions unknowingly. People receiving kits and then coming to me as patients. And actually, a lot of pediatric dentists and other dentists love Firstgrin as that tool to welcome families and parents into their practice too. So it's been an interesting, really cool full circle moment.
That's a great journey to hear that success. Now, going back to Firstgrin, does Firstgrin have an advisory board or any kind of board that you work with for the company?
Yes, everything's completely unofficial, and they're just mentors of mine who I literally cold called in the beginning. And I'd be like, would you be on this board so I can run things by you? People in the payer space, people in the consumer product goods space, things that are my blind spots that I don't have expertise in, that are my sounding boards. And they're people who really understand the mission and get it from the start. And it's not strictly financial driven. It's again the access to care and just actually trying to make it a better world for parents and kids and families.
And for those of us out there that are thinking of having some type of advisory or mentorship group behind them as they go through their journey, are there different skill sets or components that you have found that have been really helpful to have as kind of your village behind you?
Oh, totally. I mean, I think you need to be really real with yourself and figure out what your blind spots are and be like, I'm a little bit weaker at this. Who's someone who I trust, who understands the mission of my company that I can ask for advice or to help leverage their strength there to make it really balanced. And everything is teamwork at the end of the day. You can't do everything alone as much as you may want to. Um, but having people that you trust in your circle as soundboards is wildly helpful. Yeah.
And then as you embark on this journey, are there any initial stages that were challenging? I know you've spoken a little bit about cold calling and trying to get people interested that you faced as a woman in the healthcare field, and how did you navigate them and your advice for others navigating that space?
Oh my, so many. Like I could go on so long with that. The short answer is yes. Um, no one really took me seriously in the beginning. What they underestimated was my understanding of this pain point and my tangible solution for it, as well as we have a very different experience with the healthcare world as a mom. And I learned this after I had kids too. After having babies, how we navigate the healthcare system, bring our kids into a doctor, for example, those are all massive strengths, like things that are overlooked. And a lot of these calls that I am currently in, can be with boards of all older men who haven't faced these pain points. And that's a huge opportunity for us to shift and shape the experience to how it'll best benefit us. And that's how I really see Firstgrin. And I think that's why it's done so well.
It's great advice. And then we have another question. Are there specific resource or tips on oral health for families with children who have special needs, autism, ADHD, etc.?
So that's a huge component of Firstgrin. My brother-in-law has special needs, two cousins with autism. Could go have a whole conversation about that and the access to care in that realm. Wildly important. Yes, I urge you to check out Firstgrin. Feel free to reach out to me as well, and I could point you to some other great resources specifically. What I urge again is that early preventive focus, desensitization, awareness, the script around it. It obviously depends. There is a different spectrum per se for what kind of special needs we're working with, but yes, and it's a really important conversation around dental and oral health.
Thank you, Ashley. And before we close up, is there anything that we didn't get to touch on today that you wanted to mention?
No, I feel so lucky to be here. I think Columbia's been such an exceptional institution and my success and career and learning. So I'm really grateful to have this platform and it's been a really great community in that sense. So thank you.
Great. Oh, we actually had one more question come in.
Yeah.
As an entrepreneur, do you go to conferences or listen to specific podcasts that might help in this industry or field?
Love going to in-person conferences. I think there's just a different level of connection when you're in person with people. Highly recommend. In terms of podcasts, I love How I Built This by Guy Raz because it breaks down really well-known entrepreneurs and their companies, and it talks about the highs and lows and the journey. And I think that's really important because sometimes you could see people's finish line be like just totally astounded and shocked and taken aback for how someone got there. But to know the reality of the lows along the way, I think can be humbling and make you feel better as an entrepreneur to know you're not going through it alone.
And is there a specific entrepreneur conference that you've attended or are looking to attend that you could recommend?
It depends on your field, of course. The health conference in Vegas for health entrepreneurs is massive. There are payers in the space, different startups, a lot of tech companies. So, highly recommend that one. Ideally, we'll be there this year. Some things happening in motion before that. But I really, recommend looking in your niche. There's so many smaller ones too. I actually prefer the smaller ones because you're in a room with more people, you see the same faces. It's easier to talk to people, I find, rather than trying to hunt people down in huge, huge rooms and gatherings.
And you mentioned Firstgrin is hopefully going to be at that conference. Have you guys gone to other conferences to promote the company in the past?
Yeah, so Firstgrin was at Health last year when I was on maternity leave, or like I just had a baby or was about to have a baby. Timing didn't work out for me, so I had other people from my company go for me. But Firstgrin has been at a bunch of health tech conferences, both medical, dental, mom space, whatever it may be.
Great. Well, thank you so much, Ashley. We have had an amazing time hearing about your experience and expertise with us. And thank you for everyone who has joined today. I'd also like to thank our She Opened the Door committee and the CAA for making today's conversation such a success. For those here with us today, we hope that you'll consider volunteering with CAA to help get fellow alumni and students involved in meaningful initiatives like this. We have had an amazing season 2 with Ask the Expert, and we will be back for season 3 starting this fall. And you can find more about She Opened the Door on our website, which is listed on the slide. Also, please come and connect with us on our new She Opened the Door LinkedIn. And also connect with Ashley on her LinkedIn. It's a great place to find her to ask more questions or more involvement and reading about Firstgrin. And we would just like to say thank you to everyone that has joined us today. And we look forward to seeing everyone coming this fall. Thank you so much.
Thank you.